Your doctor has recommended a Bankart repair, also known as shoulder joint reconstruction surgery. The shoulder is a ball and socket joint. The socket has a cuff around it called the labrum. In your case, the front of this cuff has come loose. This can be done via keyhole or open techniques. This keyhole operation involves making small cuts around the joint to insert a camera and instruments. The joint is filled with the saltwater fluid to expand it and create room for the surgeon to operate. The first stage involves cleaning away the damaged portion of the cuff and surrounding bone. Making it bleed will help to promote the healing process. The detached cuff is then reattached to the bone socket with threads and secured into place. The fluid is drained at the end of the procedure. The cuts are then closed with sutures. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.